What meds are you on?
I used to be on lithium and Seroquel.
I was on Xanax.
You ever take Klonopin?
Klonopin, yeah.
Today, one of the most important shows that we're going to do this year about a subject that I am passionate to sound the alarm on, antidepressants. For 20 years, you've been told they're a miracle cure. It's a multi-billion-dollar business. About 1 in 10 of us is taking an antidepressant. That's more than 30 million Americans. But new research has uncovered shocking evidence that these powerful drugs are not helping any more than a placebo. Add to that, some antidepressants have horrible side effects, including nausea, irritability, and sexual dysfunction. They can also increase the risk of birth defects and, worse, suicide in teens and young adults. And most alarming, they may actually be changing your brain.
He was off and on and tried every drug available.
The doctors were just prescribing me so much medicine I couldn't even function, honestly.
It's all trial and error with these drugs because they're, everyone reacts differently. But you have to find out. So the finding out process is just awful, can be traumatic.
I was tired of having cardiologists stick in my face the fact that they do EKGs, all these heart tracings, which they say makes them a very quantitatively exact way of measuring things going on in the heart and with patients. And they're saying, you Dr. Richardson, you're just a witch doctor. What do you know? You give them all these medications, but you don't have anything to really base it on.
Soldiers' use of prescription drugs has tripled in the past 5 years.
The Army says this is all linked to the rising number of soldier suicides.
Medications I was on.
I talked to soldiers who told me that they felt that doctors were throwing bags of pills at them. And at first I didn't believe it, but then I came to understand that it was true. I had expert after expert come into my office and explain to me, and the thing I found most frustrating was that expert after expert told me something different.
%90 of suicides are related to a mental illness. Depression, bipolar disorder, schizophrenia, anorexia, borderline personality. What you may not realize is just how prevalent it is. There are 38,000 suicides each year in the United States. That means one about every 15 minutes. Third most common cause of death amongst people between the ages of 15 and 25. It's kind of an extraordinary story when you realize that this is twice as common as homicide and actually more common as a source of death than traffic fatalities in this country.
There was an extraordinary announcement 2 weeks ago by the National Institutes of Health that they will no longer fund research using the Diagnostic and Statistical Manual, the DSM-5, which the APA is announcing this week.
So if we ever really want to understand the biological basis of psychiatric disorders, we need to pinpoint these locations in the brain where these chemicals act. We have an oversimplified and increasingly outmoded view of the biological basis of psychiatric disorders. Many of the drugs that are prescribed to treat these disorders, like Prozac, act by globally changing brain chemistry. It's not that chemicals are not important in psychiatric disorders. Rather, they're released in very specific locations, and they act on specific synapses to change the flow of information in the brain.
And every dollar we spend to map the human genome has returned $140 to our economy. The most powerful computer in the world isn't nearly as intuitive as the one we're born with. And the Brain Initiative will change that by giving scientists the tools they need to get a dynamic picture of the brain in action, and that knowledge will be transformative.
Now, this is a real gee whiz story. A company in California is working on a technology that basically it's creating a huge online brain database. They want to look at how different brains respond to different medications. This could be huge for people, especially veterans facing post-traumatic stress disorder. CNS Response created this technology.
Doctors at Walter Reed Military Medical Center are trying a new system that shows promise.
It was actually life-changing for me.
Known as Central Nervous System Response, or CNS, it's simply a cap with electrodes worn during a 20-minute session to record brainwaves. The individual's brainwave pattern is then compared with a database to find which specific mood-altering drugs would likely be most beneficial.
You're a data miner.
We do predictive analytics, and the genius of the doctors who founded the company, they began to do a brain function test with EEG on every patient and correlate that with the meds they gave and the outcomes. They did this for about 25 years. It's now the largest brain database of its kind, and it predicts 2 to 3 times better the medications that your brain will respond to versus the ones that my brain would respond to.
Now, how did you accumulate all this data, and how do you parse it in a way that can be relevant for a patient?
The internet and the cloud have made us able to crowdsource this information. So now if you're a doctor in our network, the doctors at Walter Reed or the doctors in Boston or New York or LA, every time you see a patient, that data is going to go from your iPad up to the cloud, and we're going to be able to use that because we have machine learning algorithms that actually make database more predictive.
It allows us to compare and learn which medications have been effective, as well as which medications have not been effective for physicians treating patients with similar EEG findings.
Minimizing the frustrating trial and error process.
It can be life-saving for patients because you can save years of patients suffering from incorrect, ineffective medication.
Unknown risks and ineffective medications are 2 of the biggest challenges in healthcare. For example, research today will make it possible for doctors tomorrow to anticipate which treatments will work best for each person and deliver more effective, less expensive care. That means fewer trial and error prescriptions and a steep drop in the number of adverse drug reactions, which cause over 770,000 injuries and deaths a year in the United States. Pharmaceutical companies have been shifting from mass production to developing drugs custom-made for specific genetic profiles. This could transform their approach to everything from cancer and depression to heart disease and Alzheimer's. Technology startups and insurance giants are already competing to launch tools that make this possible. A more patient-centric system would save the healthcare industry billions of dollars a year and help us all get better care. And because medical spending accounts for almost 20% of U.S. consumer spending, it could create huge new investment opportunities within the healthcare sector and throughout the economy. Think about it. We do.